in order to manage autoimmunity, we really have to understand the unique triggers for every person. And those can be different in two people, even with the same diagnosis.
I'm Riley Rees. This is the Sophia Unfiltered podcast where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Welcome to Sophia Unfiltered, where real conversations meet radical self-care. Today, we're joined by Erin Holt, a functional nutritionist and Stanford-trained compassion teacher. Erin brings an intuitive, science-backed approach to complex health issues, especially autoimmune disease. In this episode, we talk about why autoimmune diseases are rising so rapidly, how conventional and functional medicine both fall short, and what we actually need to do to support healing. We'll dive into Erin's 6 investigative pillars, the gut autoimmune connection, and why women make up 80% of autoimmune diagnosis. So if you felt overlooked or overwhelmed, or if you suspect something deeper is going on, this episode's for you. Erin, thank you so much for being here with us. I appreciate all of your time this morning, and we're here chatting about all the things autoimmune. Do you want to just jump in and tell us a little bit about yourself and your background?
Yeah, I'm just super excited to be here. I'll say that. My background, I went to school for nutrition and dietetics. I really struggled with eating disorders through my teens and my early 20s. So I was like, okay, well, if I go to school and become a dietitian, I can learn how to fix myself. But spoiler alert, that is not what happened. Once I graduated, I really plunged into more alternative health and yoga and health coaching and root cause approach. And that is what really helped me to dissolve all the eating issues that I had. And that was great, and that's how I ran my nutrition practice, and after I had my daughter, which is 10 years ago now, I got really sick, and it didn't make any sense because I was doing all the right things. I was eating well, I was meditating, I was doing yoga, I was like, everybody in my life looked at me as the health person, but I got really sick, and this went on for a year, and it's kind of like the typical story that we hear so much from women navigating the American healthcare system, but I was gaslit, nobody believed me, nobody listened, and long story less long, I ended up being diagnosed with a pretty serious autoimmune condition. And that is really what spearheaded my career into the functional medicine root cause space because conventional medicine didn't have many answers for me. So I kind of had to piecemeal those answers together myself.
I mean, I can't even imagine being in this situation. So you're the health guru. You went to school for this. You didn't know what was going on when you were sick. For any of our listeners out there who may be struggling, do you want to just run us high level, quick overview of kind of like what happened at that moment? Because some of our listeners now may be in that same situation, right?
Well, I freaked out and I was like really, really, really embarrassed. And I had so much shame about it because not only did I not know what was going on, but no healthcare provider would validate my lived experience. And so I thought I was a hypochondriac. I was embarrassed around my family and my friends because I had no diagnosis or validation to be like, see, something's really wrong with me. And that's kind of the messy part of autoimmunity. It can take you over 4 years to actually get a diagnosis. You can go to doctor, to specialist, and still not receive a diagnosis. And so if somebody does actually finally get to the point where they're diagnosed with something, it can feel like sweet relief. It can feel like validation because you have something tangible to point to and see like, see, I'm not crazy.
Right.
This wasn't all in my head. I'm actually sick. I mean, I think that gives insight into how much people are suffering if getting diagnosed with a serious condition is the thing that makes them feel better. Do you know what I mean?
We hear this all the time. We hear this in mental health. Hey, look, I have ADHD. I wasn't crazy. Like, I mean, it's like, give me a diagnosis, please, somebody.
Yeah. Look, mom, I've got the diagnosis.
Yeah. I mean, which is even more sad. But so who did you go to? Like, how did you finally get to diagnosis after all of this time?
Well, I was a little bit of a bulldog. I one day my thumb swelled up to like twice its size, which is we can all agree is like weird and not normal. So I went back to my doctor's once again, and it was just this nurse practitioner. I had never met her before, and I just looked her dead in the eye and I said, "I'm not leaving this office until you find some answers." And she was like, "Okay." To her credit, she did. And there was some kind of strange lab markers that led her to send me to rheumatology. And they did a battery of blood tests. And that's where they found auto antibodies against specific tissues, enough to warrant a diagnosis of systemic sclerosis, which is also known as scleroderma. So that is how, through a lot of self advocacy, that's how I finally received the diagnosis.
So you had gone for nutrition dietetics, you had been in a practice, encompassing all of these holistic different practices, but then you really went in on, okay, functional medicine. What did that look like for you and your practice?
So 10 years ago, this was not really as much of an industry as it is now. There were certainly naturopaths and people practicing a root cause approach, but functional medicine or functional nutrition as a thing wasn't so much a thing. I always joke, I started my podcast almost 8 years ago. It's called the Functional Nutrition Podcast, and people warned me to not title it that because they were like, nobody knows what functional nutrition is. So in 8 years, this is how far we've come. But my rheumatologist, to his credit, was great. But he was like, the solution that I have for you is medication. And if you don't take this, you could die and you will be on this for the rest of your life. And at 30 years old, and I had a 1 year old at the time, I'm like, I don't know if this is it for me. So that's when I started diving into asking the questions why. And I will say that that is really the chief and primary difference between a conventional approach and a functional approach. With a conventional approach, the diagnosis gives you the treatment. So we need to find a diagnosis and then we know how to treat you. But with more of a functional root cause approach, that doesn't really fly because the diagnosis doesn't always tell us why. So just because I received that diagnosis of autoimmunity, it didn't tell me why my immune system was attacking my own tissue. And so I'm a questioner by nature. I wanted to find the answers why. And that really aligns so well with a functional approach because we take a systems biology approach where we're looking at all the different contributing factors. And we need to when it comes to autoimmunity.
Yeah, absolutely. So going back to autoimmune disease, we know they're on the rise, right? And I'm sure you have some pretty alarming rates. Why do you think this is? Are we getting better at diagnosing? Are people advocating, or are people actually getting sick at like a higher rate?
That's a really good question. And unfortunately, I think in the case of autoimmunity, it's more of the latter, where the our immune systems are just fundamentally so dysregulated due to factors in our lives. It's not just one thing. That's what it's so complex. And anybody making autoimmunity out to be simplistic or a simple approach, they just don't understand it. And I do feel like that's where functional medicine falls short, to be perfectly honest with you. Sometimes the functional medicine approach is we just have to look at your gut. We just need to fix leaky gut or fix a stool test and we're right as rain. And unfortunately, it's a lot more complex than that. So we have the antigenicity of our food, which is changing. We have increased toxin exposure. We have major league microbiome shifts. I'm sure these are all things you've talked about here on the show before, but all of these things combined has led to immune systems just being dysregulated, which can open the doorway and the pathway to autoimmunity. So I think it's a more of a byproduct of how we're living our lives. I love the quote from Gabor Mate. He says, "Our immune system does not exist in isolation from daily experience." So I think of our bodies as a reflection of a life lived, how we've been living our lives.
In an environment, right? All of it.
In the environment, exactly. The internal environment, what's going on inside of us, the external environment, what's going on outside of us as well. So I think it's that because it actually is very, very challenging to diagnose autoimmunity. There is no one test. There are certain clues that we can find on lab markers, and I'm more than happy to talk about those and share that with your audience. But there's no one definitive test that says, "Yup, you've got it. You've got the autoimmunity." So it is a really challenging thing to diagnose.
Right. And there's like over 100 different diseases. So it's not like you're going to have, okay, here are the 5 symptoms. I mean, it can be anything and they can affect you probably personally and present differently at different points in your life, depending on what's going on, I assume. But what do they all have in common? Like,
That's a good question because the question that I get the most often when it comes to autoimmunity is how do I treat blank? And that
right.
blank is their condition. How do I treat Hashimoto's? How do I treat colitis? How do I treat rheumatoid arthritis? And that question, it's not wrong, and I completely understand why somebody would ask that, but it shows us how we're looking at autoimmunity, and how we're looking at autoimmunity is part of the problem. We need like a total restructuring paradigm shift because it's not a situation of this is your diagnosis, therefore, this is how we're going to handle you. They can all be looked at as an issue with the immune system. So you can have a certain condition, but the underlying issue is immune dysregulation. And so when we're thinking about how to help somebody, when we're thinking about how to treat somebody, the treatment isn't unique to the condition, it is unique to the individual. In order to manage autoimmunity, we really have to understand the unique triggers for every person. And those can be different in two people, even with the same diagnosis. Does that make sense?
Yeah, absolutely. And it sounds like it's impossible to figure out.
We can think about autoimmunity in three different phases or stages. So, stage one would be silent autoimmunity, where somebody has the presence of auto antibodies. So, these are antibodies that our immune cells create against our own tissue. And the presence of those is not necessarily a problem. It's the presence of those plus immune dysregulation plus inflammation that is the problem. So silent autoimmunity is, yeah, there's presence of autoantibodies, but somebody doesn't have symptoms. So typically we're not seeing people in stage one because they don't have symptoms, right? They're not coming to us being like, I'm dragging limbs around here. Stage two is where we tend to see a lot of people. And so this is the presence of autoantibodies and symptoms. And there's inflammatory pathways that are lit up, which is what is contributing to the symptoms. So somebody could come in saying, I just am so exhausted, or I have joint pain, or it could be any symptom truly from top to tail because our immune system hits our whole entire body. So it could be this collection of symptoms and they're like, I've been dealing with this for months or years. I've gone to doctors, nobody really knows what's going on with me. And that is usually what stage two looks like. So we do see a lot of people there. I will say that this is where people tend to start to second guess themselves. They start to think they're like a little crazy. Maybe this is all in my head. And then we get to stage three. And stage three is the presence of autoantibodies. It is symptoms, but it's also tissue damage. So by the time somebody gets to stage three, it's really hard to reverse. We know that there is no cure for autoimmunity. So once you've got it, you've got it. But the good news is that remission is possible. So we can unpack and unwind the autoimmune process and get somebody into remission, or at the very least, help them navigate flares as they pop up. But once we get to stage three, that's when it gets a lot trickier to unwind. So my mission is to really try to catch people early before it gets to the point of stage three. And unfortunately, with the conventional healthcare model, where they're waiting for it to get to stage three. So let me give some context to this. I'll use Hashimoto's as an example because I think a lot of people are familiar with Hashimoto's. It's a very common autoimmune condition. So Hashimoto's is when the body makes antibodies against our thyroid gland. And so we can actually screen for the presence of those antibodies, specifically thyroid peroxidase antibodies, or TPO, is how you might see it written on a lab test, or thyroglobulin antibodies. These are the two antibodies that tend to be elevated with Hashimoto's. So we can do a full thyroid panel, which, by the way, I think every woman should have at least once a year, a full thyroid workup, and we can look for the presence of antibodies because 90% of true hypothyroid is autoimmune in nature. So if we're running thyroid tests without antibodies, it's incomplete. So we can catch this before it gets to the point of gland destruction. But with the conventional approach, they're waiting for so much damage to happen to the actual thyroid gland that the thyroid gland stops producing thyroid hormone. And then the treatment is to replace thyroid hormone. I'm not saying that's bad. That can be life saving. I'm just saying we should be screening for people before it gets to that point. It's why levothyroxine is one of the top prescribed medications year after year after year. I just don't think we're screening for this as much as we should be.
I know I had some personal friends go through this, and I'm pretty sure when they got the test back for the thyroid, it was like, you're not high enough to get the treatment. So, what they were saying based on your conversation is, you're not damaged enough yet for me to give you the medicine. How scary is that? And I'm not blaming conventional medicine, there is a great place for them, right? This is just, hey, when a doctor sees this, we're going to take this action. But you have to be in this range that's built for every, person out there, right? So that range may not be good for me, and I may want to get it before I get in this dangerous range. Like you're saying, I love these 3 phases. So
There's so much that you can do before it gets to the point of destruction. Food, movement, certain nutrients, lifestyle modifications. There's so much potential. So it is a shame that we're waiting for for it to get so bad
to a
that
specific level on some chart that was built for every single person out there. Yeah.
exactly. And I just want to speak into what you said too, because we have to be able to talk about problems in systems. I think it's really important that we do because so many people are suffering. Millions of Americans. It's estimated that 50 million Americans have an autoimmune disease. 1 in 12 women will be diagnosed with an autoimmune condition. So we have to talk about systems that are no longer working. So when I speak into conventional healthcare and the model, what I'm never doing is taking digs at individuals within the system because I truly believe that, and I'm not a doctor and I have so much respect for MDs. You do not dedicate your life to medicine unless you genuinely want to help people. And so we have to, when we have this conversation, we have to separate the individuals from the system.
Absolutely. And I think people get to such a place where they're hurt or broken and they're like, this isn't working. Well, and I like to say, not even the system is failing. Like, well, we have a chronic disease population, but an acute healthcare system. And that's not what that system was designed to absorb. So I think now it's like, where do we go for all of this help? Which is fine. That's where we're at. I think that's maybe what's missing between that conventional and functional approach is like, how do you self advocate and how do you get the help you need and understand that this system is built for this acute situation? Where do they go for help? What do you do? Right? Like you push that NP, you're like, I'm not leaving the office until we get some results here. But what are people supposed to do?
It's really challenging. I do feel that, we personally, my company, we have a clinic so people can come to us. That it's really important that even as my work grows and the company grows, that we are able to offer solutions for people because sometimes I actually don't know where to send them. But there are some things that I think that people should be armed with information of how to interpret their own blood work. And so there's a couple of things to look out for if you just have a basic lab work. And so white blood cell count, that's on every single CBC. That's on like just about every blood panel you'll ever get. If your white blood cell count is low, that can be a little head nod to autoimmunity. Not always. It is certainly not diagnostic for autoimmunity, but it can be a clue. ANA, anti-nuclear antibody, that's a great test to run. That can show up positive like 10 years before anybody ever gets an autoimmune diagnosis. So if you see that, say, oh, okay, something's going on here. Certain inflammatory markers, like HSCRP, that is an inflammatory marker, an acute inflammatory marker. So it will go up with acute inflammation. It is not specific, meaning it's not going to tell us where the inflammation is coming from. It's just going to tell us that it's there. So then it's kind of on the job of the practitioner to go inflammation hunting. That's what we like to call it. Okay, so those are certain things. SED rate is another one that can show acute inflammation. And these are just basic lab markers. And then so that could give you some clues that maybe, hey, autoimmunity might be part of the picture if you're struggling with these chronic ongoing mystery symptoms that nobody can help you with.
And
And
are these the blood tests that we should just be going in and asking for annually? Like, what would you ask for to have these on a panel?
so the white blood cell count is part of a CBC, which is part of most comp panels that your regular PCP can do. Like these are not fancy razzmatazzy lab tests. These are just basic blood work. So you could absolutely request a CBC. That is not unusual. ANA can sometimes be on routine blood work, but that is one that is like good to request. CRP, I believe, should be on all comp panels because that is a good marker of inflammation. We want to know if inflammation is afoot. That one we want to see that as low as it can go, pretty much. And the SED rate is also on most lab work. Another thing that can go up is iron, is ferritin. That is an acute phase reactant. So you can see ferritin go high in cases of acute inflammation. So all of these are basic lab work that your GP can run.
No, that's great to hear because sometimes, it's getting extra tests is kind of, you get some pushback sometimes. And I know that you also mentioned for women, we should be really screening for the thyroid annually, right? And that's probably a special test as well.
Yeah, and this one can get tricky. And I just posted about this in my Instagram stories, and I have a ton of DMs right now of people saying, I asked my endocrinologist for this, they refused. I
Yeah,
asked my doctor
that's right.
for this.
That's why I said, is this a basic? Because you're not always, unless you're presenting, you're not going to get these tests, right?
So typically when we're looking at thyroid conventionally, we're looking for TSH, maybe T4 if you're lucky. TSH is something that the pituitary gland creates. It's thyroid stimulating hormone. And so if it's really high, it can tell us some things like, okay, we should go looking, but you can have a normal TSH in normal conventional ranges and still have suboptimal thyroid hormone T4 and T3. T3 is really the active thyroid hormone. It's the one with the most punch that's doing the most things. So I always like to see T3 because we can have conversion issues between T4 and T3. So there's just a lot of things that we're looking for. So full thyroid panel, just so people have it, you could probably Google this, but it's TSH, total and free T4, total and free T3. I like to see T3 uptake, reverse T3, and then those thyroid antibodies that we talked about before, TPO and thyroglobulin antibodies. That really shows us a full picture of what's going on with thyroid health.
And is that pretty easy to request from your doctor?
It is not. Right. That is the one. Some will do it and they're like, yeah, totally, no problem. And some will really argue on it that they're not validated and that they won't show us the information that we need to see. And so that's sometimes where functional and conventional approach to thyroid health can disagree.
Yeah, that's kind of a shame. Well, I appreciate you being here with us so much and jumping into all of these phases and the different symptoms and the different tests that we should be asking for. Before you go, though, there's one thing that, that we were talking about beforehand. And I know you mentioned 1 in 12 people are going to have a chronic condition, but you also mentioned that women are getting diagnosed higher than men. What is going on?
Yeah, so the stats are 1 in 12 women. Hold on to your butt because I'm gonna say something else that's gonna blow your mind. It's 1 in 24 men. So there's this huge gender gap. So autoimmunity affects women twice as much as it affects men. And part of this is hormones. We didn't really get into necessarily the things that can tripwire the immune system, but when I'm thinking about why does somebody have autoimmunity, there's 6 main factors. Food and diet, what's happening at the level of the gut, certain types of infections, environmental toxins, stress. Stress is a huge trigger and exacerbator of autoimmunity. And then there's mindset, beliefs, history of trauma. So those are the big six that I'm thinking about anytime somebody comes to us with autoimmunity. Where in the six are we? Do you got three of the six? You got one of the six? What are your big triggers? And so, because one of those is stress, we have to think about the stressors that are put on women and how we are conditioned to behave, how we are conditioned to believe about ourselves, or what we are conditioned to believe about ourselves. Women are taught from a very young age to be the peacekeepers, to be the people pleasers, to be the put ourselves lasters. I
I
remember
wonder if COVID, now we're seeing like this major spike because, I didn't have kids at the time, but I've got little one. And now being at home and working and with a kid and they're out of school. Can you just imagine that stress? Well, you went through it.
I am lucky that I have a very supportive partner and I don't really uphold. I do what I call radical momming where mom has needs too. Mom is a fully formed human being with her own needs. And I will say for anybody listening, that was the gift of autoimmunity for me. I was diagnosed when my daughter was 1. And so as a mom to a 1-year-old, I had to make the very hard choice to put myself first, to be a priority in my own life. That changed the trajectory of my health, my life, and my entire career. And I'm so grateful for it. But if you think about what's the highest praise you can pay a mom in our culture? She's so selfless. It's like being a good mom necessitates that you abandon self. And what is the underlying mechanism of autoimmunity? You lose the ability to differentiate self from non-self. So there's a hormonal perspective to be sure. Estrogen really, really impacts, and progesterone too really impacts the immune system. And women go through these huge endocrine changes throughout our lifespan, whereas men do not. And that is a factor. In fact, we are more likely to like tripwire autoimmunity through one of those endocrine transitions changes. So that could be pregnancy, postpartum, perimenopause, menopause, because our hormones are all over the place. So hormones is a big factor, but I think an even bigger factor is just we are conditioned to put ourselves last. If we cannot say no for ourselves, our body learns a way to do it for us. And I really think that that is part of the gender gap with autoimmunity.
Yeah, I can see that very clearly. So, if it's kind of related to these big shifts in our hormones, can we get tested at these different trigger points, maybe before and after? Get a baseline and then after to see what's going on so we can hit that phase, maybe phase two before we get to phase three?
So I train clinicians too, and this is the way that I talk to clinicians and practitioners. We do not want to fearmonger. We want to make people aware that hey, this is happening, this is real, and this is what's going on. We cannot change the fact that our bodies will transition as women. Like that is going to happen. HRT in the world is going to change it for you. However, if we know how to support our immune system, that is a really useful skill in life. And we just want to make sure that we're really doubling down on that through our endocrine transition. So, taking care of yourself, eating well, moving your body, supporting your gut health, supporting microbiome,
Managing stress.
reducing your stress. And like that's why I bring up the other thing because some of these stressors, like we know when, certain stressors, like we can identify them, but some of them we can't. Some of them are subconscious stressors. And putting yourself last and putting everybody else's needs above your own, that is how we're taught to live our lives. So we think we're doing a good thing. So some of these stressors we're not even aware of. And so being more aware of that, being more mindful of that and supporting ourselves through these transitions is key. I don't want people to freak out and be like, "Oh my goodness, because I'm pregnant, I'm going to get an autoimmune condition." Take care of yourself. Make your health a priority. You're probably going to be okay. But yes, you can. I think getting thyroid physiology checked is really hypercritical postpartum. And we know that if we see some shifts in thyroid physiology, we're going to be more likely to end up hypothyroid and with Hashimoto's later on in life. So just like keeping your eye on that and making sure you're doing everything in your power to support your immune system.
Yeah, and then also, I believe in being an advocate for your own health, right? So if I want to go in and get my thyroid checked annually, or just make sure some of these tests, the WBC, ANA, the CRP, making sure I know what panels, what to ask for, what I'm looking for, and to kind of take it upon myself to say, okay, these are kind of some of the things that I can notice myself, right? In case I change doctors or something else, like nobody's going to take care of yourself like you are. So I think just being an advocate for your own health and knowing where we stand, I think is a really good place to start. Normally we're like, okay, blood test came back fine. Well, what does that mean, right?
Really good point. And just to stick with the autoimmunity, it's when you're looking at things like your blood cell count, white blood cells, it's not just what's high and low according to the lab reference range, but it's according to your reference range. That's why getting basic blood work is so wonderful because you can look at your baseline and you can notice shifts in trends and say, wait a second, this used to be higher. Now it's lower. What's going on here?
Yeah, absolutely. I think that's the same. And I know I have to do that for my blood pressure, right? I run low. So I'm not even close to the 120. So when I'm getting to their normal or high range, I'm like, I am way high. Okay. Something's dangerous. So I just really, for all of you listening out there, I just really advocate, to be an advocate for your own health, right? I think is a good way to put it.
Yeah, and you said no one's going to advocate for you like you will, but like advocate for yourself. Your relationship to yourself is the most important one, and see yourself as high value. Like you bring a lot to this world. You deserve to feel good. That is a birthright. You deserve to feel good. If you're not feeling good, that is not okay, and don't let anyone tell you that that is not okay. So advocate for yourself, be the annoying one. I had a friend of mine who I grew up with just recently was like, I've been having a lot of chest pain, but I don't want my doctors to think I'm overreacting. I'm like, go to the doctors and stomp your feet until somebody listens. Who cares? We're so worried about the what the world thinks about us that we won't advocate for our own health. Like we have to change that script for ourselves. Like your health, your relationship to yourself, the most precious, valuable thing. Nobody's going to advocate for you like you will, but make sure you're advocating for you.
Yeah, do it. Yeah. I can hear you saying this from a place of you've been through this, right? Like that just totally comes through. So you're not just saying this, like you actually lived it, right? So I just think that that is
And then
powerful.
I've worked with thousands of women who have navigated this. And it's like, I will be your tough love bestie, like pushing you in the back, go do it until you actually do it. I'm not the person to come to where I'm going to rub you on your back and tell you everything's going to be okay. I'm going to like make you do the hard thing because I want the best for you. Even when you're faltering, like I'm going to be the one egging you on and pushing you.
Because you know you can get through it. You know you can get into remission. You know you can take these, find some answers, and then let's do something about it. Like I can hear it in your voice, right?
So much hope available, even though autoimmunity is not curable. Like I said earlier, remission is possible. And I was in a bad, 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 bad way. And now I am not. Now I feel great and I live a really wonderful life. But 9 years ago, I was scraping the bottom of the barrel and I was really scared and I was in a not good place. So there is a rebound that is available to you, but you have to advocate for yourself in order to get there.
And so it is possible. I love this passion, this enthusiasm, the lived it. So call Erin.
Here's my cell phone number.
But Erin, thank you for being here. A question that we ask all the guests on the show: if you could share three fundamental pillars that contribute to your well-being.
Okay, making myself a priority in my own life in case that wasn't clear yet. That's a big one. And I remember I do this as a mom too. Because people are like, "Well, I have kids." I'm like, "Cool, me too." And still I show up for myself. Our belief informs our biology. So what we believe about ourselves, what we believe about our ability to heal is really, really important. I will say that's the number one deal breaker of whether or not somebody gets better. Do you believe that you can?
Mindset. Wow,
Yeah.
that's
It's a
interesting.
huge component of the work that I do because it was such a huge component of my own healing. You really have to believe that you can heal and that you are worthy of healing too. Really important. You can do all the tests, all the protocols, all the supplements, all the medications, but belief kind of trumps them all. And then, geez, third one, I don't know, deep breathing.
I did hear deep breathing is like this amazing, if we do it right. I hear most people don't do it right, but I hear deep breathing and this is amazing. It triggers the vagus nerve and it triggers all this calmness immediately. And I was like, gosh, I wish I'd known that sooner. Wasn't
You
breathing right.
have an untapped pharmacy that lives in your body all day, every day. And I say untapped because we have to do certain things to like activate these certain chemicals. Breathing is like the best way to just set some things off. Yeah, you will change the chemical makeup of your body, but we don't take time to do it. So breathe. Yeah, let's stick with that one.
Yeah, yeah. I think that's, I mean, it's transforming. Also, go Google it because most people don't know they're not breathing right to actually get these benefits.
Yeah, breathe into your belly, not into your shoulders.
Yeah, yeah, I don't do it right. Can you tell our listeners how they can connect with you and get some more information or maybe get into your programs? Hopefully, some are virtual for some of our listeners.
Yeah, we're all virtual. That's the gift of 2025. You can find me on my podcast, the Functional Nutrition Podcast. You can find me on Instagram. That's where I spend a lot of time, for better or for worse. Functional is spelled with a K, so the Functional Nutritionist. And then we do work with clients in our practice and in our programs as well. And that the website is the Functional Nutritionist. And then we have the Functional Nutrition Academy, FNA, and that is our 14-month practitioner training academy where we train all different types of practitioners, RDs, NPs, PAs, RNs. We had our
Now, are
first
these only
MD.
clinicians? Are you, what about health coaches and
Some health coaches, depending on the certification, some health coaches, we've graduated some really awesome health coaches that have gone on to do some really great things. So if you're looking to expand your knowledge into functional nutrition, functional medicine, this is the path for you. We offer so much mentorship, which is so crucial and a thing that is really missing in a lot of continuing ed. So FNA, Functional Nutrition Academy.
FNA? Thank you so much, Erin. I appreciate your time and sharing all this wonderful information with our listeners.
Thank you for having me. It was great.
Thanks so much for listening. This has been Sophia Unfiltered, a podcast by Sophia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Rees. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.